Okay, so Michelle, thank you so much for sharing how you got to, getting to treatment. And we're going to dive into that. But first, you did mention transferring hospitals. And so I just wanted to address that really
Yeah.
quickly. What was it, because that first hospital didn't have the specialty with leukemia, or what was the decision there?
Um, so basically it was the cryopreservation surgery. So the hospital I got diagnosed at was a Catholic hospital and they don't do like fertility. Um,
Gotcha. Yeah, they don't do the fertility preservation. And so again, we'll dive into that in the fourth segment, but I wanted to address that it was really that's what catalyst that was the catalyst for shifting you over. And so you ended up going to Yale. Describe sort of what you were described, or how it was described, your treatment, what that would look like for you.
yeah, so they obviously like as the thing about AML too, or like any form of leukemia is as tests come up, the treatment differs. So again, as we mentioned before with what to expect next, that definitely was a question like eating at me because it was very much like the doctors would do rounds, or even the first day I was hospitalized, I had like four different people come in to greet me, like and I got there at like 7 p.m. I'd had four doctors in the next like 2 hours, and then I went to bed. So it's like a lot of information thrown at me too, a lot of packets, materials. So that part, even though I do like knowing technicalities and all the medical, it was just like a lot of information and you're talking to your loved ones. So that part was like definitely overwhelming.
What helped
Um,
you? I'd like to interject here just to ask for guidance for other people. Like, you're getting thrown all this information verbally, written in terms of
mm,
packets, and then you're having to communicate with your loved ones. But did anything help? Like, did you designate one particular person to be a note taker, or like understand this part? Did you record some of your appointments? I'm just curious.
Oftentimes, even the nurses, like I would ask them lots of questions too. And after a while, you see the same nurses again. So it's helpful because then they have direct communication with the doctor. If Because you only see the doctor like once a day unless something's happening. But the nurses very much communication wise were there for me the whole time too. So having those two lines of like support in general, but I did have like a folder and like a little notebook for like anything I needed or like any questions that I thought of during the day that I'd want to ask the doctor. I'd most likely write it in my like phone in my notes section. But it was nice at the hospital. They had like a whiteboard. A big part of leukemia is blood counts. So they would write my counts up there too. That kind of helps with like affirmation. That was like going through treatment, but before treatment too. Yeah, definitely a lot of information and hard to organize, but having a nurse or being able to talk to someone you're comfortable with, and for me, it was my mom, definitely helped.
Yeah. To your point, not everyone has that. I'm glad you did. But what you said is relatable and is something people can take away, um, because they have like social workers at hospitals, nurses, who are very familiar, of course, with resources and how to help translate all the medical jargon
Yeah.
that gets thrown at you. And so before we get into your chemo, did you get a PIC line or a Hickman line first? And did you ever do IV, or was it just too intense for IV?
So I got a Hickman, and that's um, so or a central line as they would call it, but that was the IV. I definitely had IVs in my arm before they put the line in, and a hard part about this too is I'm a tough stick as they call it. So yeah, like you can probably still see a little bit of the bruising, like the not bruising, but like discoloration, I guess you
Yeah.
would say. Um, but for treatment in general, it's necessary to have port. They're doing labs every day. The another tough part about it is the labs every day is it was like, I don't know, 5 in the morning. They wake you up and do labs. And then when you're first diagnosed, it's all the time, like they're getting from your port all the time. So until the Hickman is put in, you're getting poked all the time, which like takes up the veins as well. But yeah, I that was probably one of the first procedures or major treatment event for me, and besides a bone marrow biopsy, which also back to that was a little scary too.
Actually, since you and I know altogether you would have like 15 or something is what you
Yeah.
had written, and when I saw that number, I was like, "What?" Um,
Yeah.
I had just 1. So, I mean, so if you
Mhm.
could sort of describe the bone marrow biopsy, for people and how most of all, sort of like how you were able to learn how to get through it as best you could.
Yeah, it definitely I remember the first time because this was the scariest time, especially. And at St. Francis, or the hospital I was originally diagnosed at, they used like a drill, which that was the only time they ever used a drill. And I remember the sound of it, and like my hands getting clammy. I was like, oh my God. But it honestly, like, it wasn't that bad. That time I did have like uh a shooting pain down my leg, but all the other times, no. But it's definitely the nervous reaction, like the need. Well, not that I'm seeing the needle, but the needle's huge. They're drilling a hole. They're yeah, getting the marrow. Just the whole process is kind of nerve wracking.
All the
But again,
sensitive.
yeah, the residents were all there too, so it's like I remember them being super supportive again. So it was yeah, nice. And then when I got transferred to Yale, this was also they had to do another bone marrow biopsy because it's different hospitals. So it was like a week and I had another one, but definitely a nervous feeling. But now I'm very used to them. Yeah.
I mean, you're a pro, but I don't know if that's the right word, like veteran pro. I mean,
Yeah.
but to your point, it's like the sound, is
Mhm.
like very concerning. Like, yeah, I couldn't see it obviously, but I could hear it. I was trying so hard mentally to transport myself somewhere else,
Yeah.
as it was happening. I remember my then fiance was like, "Do you want me to take a video or a photo?" I was like, "I don't know if I ever want to see what's going on back there, but okay."
See that needle.
You enjoy the view. I'm good.
Yeah.
So okay, thank you for that. I think that'll be helpful for people. And and then of course, you're in the hospital for your chemo. Can you describe the regimen? I know you said the first one was chemo 7+3. Describe what that means. How long the infusions were, and then we'll go into side effects.
So for my first round of chemo, um, is 7+3. I forget exactly what the drug names are, but it's 7 days of a 24-hour infusion. And then on the first three days of the 7 days, I would get another push drug. Um, yeah, so definitely like having the bag carrying around with me in the shower was just yeah, it's annoying nuisance, but I would say side effects wise, I didn't get them till like a week later because it just takes time for it to kick in. And then this shortly after that, I think it was I forget the day count of the schedule, but I think it was um 2 weeks later, so day 28, they do another bone marrow. And then that's when they made the decision to do another round of chemo because it was greater than 5%. So then I had 5+2. I think it's the same drugs. So again, 5 days, 24-hour infusion, and then the first 2 days are a push drug. So
D-
that
does
was
does I just for the drug names, I'm curious if these ring a bell. Was it idarubicin? Was that one? And cytarabine?
Oh, cytarabine, yes.
That was one. Okay.
Yes. Yeah. Um, but yeah, but then after like then they do another bone marrow, maybe week or two after the 5+2, and then it was under 5%. But that whole time I was down at Yale for 2 months. So I got diagnosed on April 23rd, but at St. Francis. So a week later, went to Yale, and then they started treatment probably a week after that. But then I didn't get released till the end of, I think, the beginning of July, end of June, like the 30th. So yeah, it was definitely a long time. The room was like, of course, nice. They had a healing garden, which like I love to go out there when I like could manage. But like my some of my friends were able to take the train in, which is super nice of them. And then my parents were around, they came every day. So I definitely had the support system while being down there. But it was just, yeah, a little. I also did, sorry, so, just remember, I did make a friend too. So most people with my diagnosis are male, white male, age 60 plus. So obviously being biracial, being young and a female doesn't hit any of those categories. But when I was down there about a month in, another girl around, she's 18, which like she just makes the cut then from pediatric to adult. But it was nice because we would go on walks together. We're going through the same treatment, and she's still a friend today. Like we have, yeah, she's doing really well too. But we just had, it was nice to go through something together and ask those kind of questions that, like, I didn't know anyone else around my age, like why, like the why for me was a huge emotional impact for me, and having someone else around the same age group gave me a little more affirmation, I would say. But yeah, it was nice to make a friend.
I definitely want to talk more about this too in the last segment, segment 4, because I think the experience of being young and diagnosed with cancer is, of course, an entirely different experience. So, but I'm so happy that you were able to meet someone you felt, could relate on some level.
Mhm.
But on that note, being there in the hospital, you were there for 2 months.
Yeah.
That's a long time, of course. I don't have to
Mhm.
tell you that. And so, for other people who are facing a longer hospital stay, what are some tips in addition to the visitors? If people don't have access to that, what else helped you get through the day?
I would definitely go on so the wing itself was kind of a circle. I would go on like walks a lot, do laps, as they would say, but just I am a huge proponent, especially obviously going through this, about physical health as well as mental. I believe physical health does help mentally as well. So just even the little, not that I was doing anything crazy, but the little walks help too. And then you would wave, like if there's other people walking or the nurses, they would talk to you. The nurses in general is another thing. I remember the royal wedding was happening when I was diagnosed, and one of my nurses like, "I'm only gonna do this for like a couple minutes." I was like, "Yes, stay, watch the royal wedding with me." So she stayed for a little. So I definitely made really good friends with nurses, but that's definitely it helps pass the time, helps emotionally as well. And then, as I mentioned too, the healing garden. It's just nice to be outside, get some fresh air. Um, and it was they have like little trees and like a little waterfall, so it was nice to go down there as well. But also though too, um I did was in the hospital during COVID as well, so some of I did experience the differences between my first day and second, just with visitor wise. Because there's a point when I was allowed no visitors at all. um but I would like try and entertain myself. I gained a lot of hobbies. I used to knit a lot. I still knit, or like before diagnosis, I knit a little, but during diagnosis, I knit a lot. I colored, watched a lot of movies, got great recommendations from friends. I still have a huge list today. I read a lot. I enjoy reading now too, so much. But finding those little things that will just make you happy. Puzzles was a huge one too. Um, but any activities too, just to keep my mind like busy and have a little fun, I guess, in it.
I love those suggestions, these things that you could do on your own, and I want to see some of the products of your knitting, of all the all the time that went into that. We'll have to put a picture up or something.
Yeah.
That's so important to talk about what mental it helped with the sort of the mental and emotional parts of going through such a long treatment. I do want to ask about the physical side effects as well and dealing with those because it's so real. And for your particular chemo, I believe some of the more common ones, and we'll really go into hair loss. Let's hold off on that for a second. But
Yeah.
mouth ulcers, neutropenic fevers, nausea, vomiting, decreased appetite, bleeding. Those are some that I think come up a lot. Can you say which ones of those, maybe all of them, that you experienced and any other ones? And then more importantly, how you were able to maybe reduce the side effects at all, or what helped get you through them?
So definitely all of those I experienced. Um, I would say probably the worst ones were nausea. Um, just like you can't keep anything down. The chemo is just so intensive. But there's medications that help alleviate that. Zofran is a huge one. Other ones are like push drugs, so that reacts faster. But I would have the nurses are great where you can just ring your call bell and they'll come. Another one too is just tired. You're like people are trying to visit. I remember it was so nice. Like my parents would come and then my friends, and then sometimes my parents and friends would just talk to each other. It was like nice to have them visit, but I'm just so tired. And then I would say the third one would just be like strength. Like my second time after my relapse, after coming out of the hospital, I just couldn't even walk. Uh, so you're in a bed all day, and yeah, I'm talking about doing laps. I try to be active as much as possible, but your body mass decreases so much. You're not eating, I guess, too, is a big one. I just didn't. There are days I tried so hard to eat, but there are days you just don't eat anything. And I would try to take supplements, and it's crazy how little you can eat. Plus you're throwing up. So even if you try and eat something, you just throw it up. And it's so hard to tell. My parents would be like, "Oh, Michelle, just eat, please, just another bite." And I was like, "I am just full. I'm just full. I physically can't. I'm gonna throw up if I eat anymore." Um, but all that just like weakens your body so much. I'm obviously I love activities. I love running. I love being active, all that. And to the point I'm 27 years old and I can't even walk. It affects you mentally too. It was, yeah, so hard to like have that on my physically, like I needed a wheelchair. And it took like a couple weeks for me to even get up to like walking up to the doctor's office. So those definitely, like, I would say the biggest symptoms. Lost a third of my body weight, which is crazy. Um, and I was just so weak. That's again, I needed to get like wheelchaired up to the hospital, and I spent like another week in inpatient during that time. So it definitely affects your body physically. Yeah, as like nothing I have ever seen.
Yeah. and you know, the way you describe it is just really showing the day-to-day impacts. I mean, it's not just physical. I mean, everything's interconnected. So whatever's impacting you physically, then it's like a weight on you, and it mentally you're carrying it, emotionally you're carrying it. With the wow, you lost 1/3 of your body weight. I mean, that's a lot.
Yeah.
What, how did you at least, I don't know if you ever were able to put it all back on, but like, you know, what helped you trend in the right direction? Did anything help, or was it like you just had to wait until treatment was done and you could start to eat again? And
This is with my first transplant. The chemo was just so intensive. So it took me almost like a year to get back to like regular eating. Like it, I just couldn't eat a lot of food even a year post transplant. But I eventually did see a dietitian about it. So I talked about foods. The Leukemia and Lymphoma Society has like a lot of resources, and I talked to them. My work has a program called Consumer Medical, and they sent me cookbooks about, oh, if you're experiencing symptoms or what's good to eat with you. Also, just in general, a transplant, since you're wiping away your stem cells, you're starting from scratch. So the first 100 days are crucial. And I couldn't eat fresh vegetables. Like I still haven't eaten sushi, no raw meat. Your immune system is just so weak. Any bacteria that a normal person can handle, you can't. So that's also leaves you up to higher risk. The first 100 days, you can't even leave the house. Like I didn't leave my house, which is just a different part of my treatment versus someone else. But that, like food wise, I had to be super sensitive and careful about. But I did find the resources, and then currently, um, I do feel like my appetite is pretty, I would say, relatively back to normal. I did gain more weight, but obviously I'm not up to what I was before. But I think I'm like a good size now. I'm comfortable with my body. I did go through a lot of the ups and downs mentally of being one weight size and then losing that much weight. I remember sitting on the chair and I was so bony, it hurt to sit on a chair. Um, but just mentally, that part of losing, even like a year or two after transplant, my like just thought process of my physical body is just so different from someone else's, because I'm just my body weight ranged so drastically, and it's hard to describe that to someone, especially in a culture very much about like, oh, we like this stigma perception of what a woman should look like. And I was going, even if I only gained like 5 pounds, for me that was like a lot. And having that my body transform so much was like a lot of hard on me, but very much better. Great to see the like dietitian and reach out to other resources as well, which helped.
okay, so a dietitian helped. I know some people go see nutritionists, and it's to each his or her own, right?
Yeah.
But actually, since you brought up the transplant, can you describe the stem cell transplant, that process? It was allogeneic, right? So it was your brother who was the donor the first time. Can you, yeah, describe the process for anyone who hasn't been through that?
How my treatment was, it I believe it was about 4 days of chemo. And for my age group, or for me, they obviously do tests on it beforehand. And just there's different variables with transplants. But me being young, they did the most intensive chemo. And then you have maybe a day or rest, a day or two of rest, and then the transplant. So prior to this, my brother, he got swabbed. They saw he actually ended up being a perfect match. Yeah. And then he on the side, he lives in he lived in Texas at the time, but my dad went out to visit him because they're just like, oh, this is something very new. We're not sure. Um, but they took his stem cells out. He had like apheresis. and they froze his stem cells. So, and then transported from Texas on plane to Connecticut, which is the technology behind it is crazy. And they have it frozen, and then they were just waiting on me. So he had that done like July 2018, and then I didn't get my transplant till uh September 7th was the date, but I got hospitalized on August 30th. So they just were waiting on when my counts were recover and the most appropriate time for me to receive the transplant. But and he came to visit too, which was like during my transplant, so it's nice to see him and have him there as well. Um, but it does take I was in the hospital for a month, so that's probably approximate days of an average transplant. But it does take a lot on the body, and as I mentioned, my chemo is super intensive. For a person who's maybe 60, it could kill them. That's how they make the chemo bag to it's your specific regimen. So there for a month and then came home, and obviously chemo takes a little time to come in effect, and that's probably where obviously in the hospital, like, yeah, just very sick, starting to lose a lot of weight, all that, and then going home, same kind of process. The first 100 days, as I mentioned before, just extremely tough on the body. Your immune system's so low. They call you almost like a newborn baby, because you have to get like all your vaccinations again, like 1 year post transplant. So you're just that susceptible to all the diseases that are out there. I think I was on 28 medications when I left, which is, yeah, crazy. So it's definitely just like a lot of, in the transplant too, for that regimen, I had a Hickman, they put in a PICC line too. You just have so much medication going through you. Yeah, so it's definitely a lot, but yeah.
28 medications. My
Yeah.
God. It was, and those were just because as you said, you're a newborn baby, they call it your birthday, right? So,
Yes.
and so were they just for like preventing infections? Like, can you recount some of them or?
Major ones are TAC and CellCept. Those are immunosuppressants. So helping when you get a new immune system, it has to acclimate with the rest of your body. So in order for it to acclimate and not attack like your organs, which is kind of like a host versus graft disease, it helps so that doesn't happen. And when I had that transplant, they actually had like a line of TAC going into me. But then the other ones, just like antiviral, antifungal medications. I was on Zofran, that's a huge one because of vomiting. I also, well, prior to the transplant too, I had Lupron injections for fertility, just all over, just a lot of antiviral kind of, antibiotic kind of medications.
Anything that there was, you were taking it. It's what it sounds like. You just had the whole pharmacy at
Yeah.
home. Did you, at home, what helped you keep track? Because that was another thing. I didn't take 28, I think. I had a lot of pills to take. And my husband helped me, keep track like with Post-it notes to remind me, and then like we bought those pill boxes. And I remember thinking like, oh my gosh, I never thought I'd be young using these pill
Yeah,
boxes.
having that much medication. Yeah, so it was super nice. One of the perks of the hospital is when you go into transplant A, they have like this kit for you, which like included a pill box. So my pill box is literally probably like this big, with like each day it had 4 slots because I'd have a morning, noon, afternoon, evening dosage, or kind of regimen. So that definitely helped. And then they had a calendar, or like calendar printout of like all the medications, and then it had, you have to take this many tablets at this time and everything. And then post transplant is, they give you all the medications so you have them right away when you go home. Um, and then you can reorder as going on. And then I would definitely say, obviously, like I I'm I'm going back to the young part, but I'm very like in tune, but an older person, you can have someone else help you too. Like my parents, I'm was still living with my parents at the time, so they were definitely a great resource to have, and they would have helped me with medications too. But I was very, yeah, on top of things to get them done. But it was nice because I do it weekly. I'd have my little like chart that they gave me, and then the pill box, and I would put the pills in all of them. And then obviously at the end of the day, if there's pills in it, then it's like you missed your dose, which hope I don't think happened, but that would be the case of that. So
Okay.
definitely it took a little organization as well, but it was nice they gave you the pills. And also when you leave to the pharmacy, a pharmacist comes up and talks with you, which is again nice because it's a lot of medication. You aren't doing it on your own when you're in the hospital, and the hours are like very weird when they're giving it to you. So it's definitely overwhelming, but having like the pharmacist explain, having those like resources with you too. And then there's on the pill chart, it was an explanation of what the drug is. Because when I was going through it, I wasn't like paying attention to what each drug is. But and then you have their number too if you want to contact them or the doctor.
Yeah.
Worst comes to worst. But yeah, definitely a lot of meds to go through.
A lot of meds, a lot of information, and just I mentioned it a little bit earlier, but for anyone watching, feel free to ask the person you're talking to if it's okay to record them on your phone. You know, we have our phones everywhere.
Yeah.
It's just nice to be able to reference something later, especially because I can't write notes that fast. So it's like, let me just record
Mhm.
this, and you can sort out the information after. But so Michele, the last part then of that first treatment, the first line was the stem cell transplant. Right? And that was September of that year. And then you were recovering. The first 100 days I know were tough. You were talking about that.
Mhm.
But then the follow-ups, how often were you getting your follow-ups with your oncologist?
October 2018, slowly from 3 days a week to once a week to once every other week, till July is when I started going once a month. So it's still a lot. And day 30, you got another bone marrow biopsy. Day 100, it's a bone marrow biopsy. Day 180 is another bone marrow biopsy. And then 1 year post transplant, another bone marrow biopsy. And then you start getting your vaccinations. So you have a vaccination calendar. So,
So much
yeah.
to keep track of.
I know. They also gave you a calendar, this too, but it's definitely, as I said with the information, it was a lot. I had folders. Yeah.
Binders of information.
Yeah.
So before we move on to your third segment, Michele, where we talk about the relapse and your second line treatment, my last question here is you were having to do all these, follow-ups, and in particular these bone marrow biopsies, which are not fun. I know you got used to them, but every time, of course, they're checking to make sure that everything is
Yeah.
good and all is
Mhm.
well. So that's another version of what we call scanxiety, right? Where it's like there's this
Yeah.
buildup of, okay, like I'm sure things are fine, but so how did you best handle, that anxiety as you're waiting for the results each time?
Yeah. It's definitely like nerve wracking, but I think also in my mind was, oh, I got a cell transplant. Like, there's no way it's going to come back. So I was trying to see the positive of it. Like, there's no, like, just seeing the good side of things, rather than focusing on like the negative, because that will give you anxiety if you, and very much throughout treatment in general is obviously it's a hard diagnosis, you're experiencing a lot mentally and physically, but you have to, one of the things I learned is A, be positive, and then B, perspective. Like, you're going through something so hard right now, but there is a light at the tunnel. You will get through this. It is a lot mentally, but just having that positive thoughts, and even though you're going through a scan, just to be positive in general, and you have a great support system, like you've been through it, like just be positive.
Thank you so much for sharing that, Michelle. I know it's not easy, but you were able to do it, and so I'm sure that will provide some inspiration for people. And coming up will be the relapse and the second line treatment experience for you, Michelle. So that's next in segment 3 of Michelle's story.